Hi there. I'm Peggy Gallagher, and I coordinate the program in early childhood special education at Georgia State University. We're right in the heart of downtown Atlanta. And I think the reason I was invited here today is because for the last almost 15 years, I've coordinated our program called Skilled Credentialed Early Interventionist. It's a collaborative of universities across the state of Georgia that works with our Part C early intervention program. So Part C of IDEA, the Individuals with Disabilities Education Act. And our Part C program in Georgia is called Babies Can't Wait, so I may refer to babies. And our lead agency is actually the Department of Public Health. We train people across the early intervention system, and a couple other people today, I think Claire earlier from the Ounce of Prevention, and then Margaret from Massachusetts was talking about the range of personnel working in early intervention, from OTs and PTs in speech language, school psych, social work, psych, counseling, psych, et cetera, work in early intervention. And so long ago, we sort of decided, and I say we, meaning a lot of people in the state, there were many, many meetings, and decided that we needed some foundational topics in early intervention. And so that's really what my project does, is the training on these topics. We have professional parent trainer teams. We offer the training both online or in person, depending on whichever they want to choose. We also have lots of follow-up. In fact, the trainers are actually paid to do the follow-up activities with the people once the workshop is over. We also have linkages to continuing education opportunities, becoming credentialed. We work with higher education personnel throughout the state to try to infuse early intervention into whatever their course topics are, be it physical therapy or speech language, whatever. We're always trying to get that 0 to 3, 0 to 5 focus with whatever the topic area might be. We also hire parents. I have 11 parents across the state of Georgia who have, whose child has been in early intervention and who work with other parents on information sharing. It's not really a counseling support kind of thing. It's more, you're in this brand new system, your child's just gotten a diagnosis, what is this all about? So it's really an information sharing. One of the questions I was asked was about referrals and linkages among different services and settings. We actually have really nice linkages for a lot of the adults. Our funding agency has always been really open to the foundational training being open to anybody who might touch a child in early intervention. So be it the whole home visitor program that's run out of different agencies and somewhat out of our governor's office, those folks can come to the training. Parents who might be foster care parents who might end up with a child in early intervention are welcome to come to the training. We have inclusion coordinators over in our Department of Early Care and Learning who are going to be working with child care centers, and they can come to the training. So it just sort of depends on wherever the linkages need to be, and the Public Health has been very open to people coming to the training, even though they pay for it. Now, for children themselves, it has been a struggle sometimes with the linkages. I think one of the issues is that, as most of you know, in early intervention at 3, the children go into a different system. In some states, it's all one system. In our state, it happens to be 2 systems, and they would move from the Department of Public Health into Department of Ed programs, with a focus changing from being on families into being more on the child. And so that that transition is hard for children and families at times. What else did I want to say on there? I think the other thing I would say is that for very young children who are deaf or vision impaired, deaf-blind, those children are served even under another department, and so getting their linkages is something we're constantly struggling with as well. Another question about the skills and knowledge that providers need to navigate the linkages. Certainly, our training is based on the NACI and the DEC, the Division of Early Childhood, of the Council for Exceptional Children standards. Those have now been aligned. I actually worked on that national committee, and we've aligned the CEC and NACI standards. And certainly any foundational training, I would think, should be based on those standards. When I say child development, I'm really talking about language, social, motor, physical, cognitive, and I would add adaptive. That's one of the areas, if you're not in special ed, I think we forget about a lot of times, but adaptive skills would be something that we would focus on as well. And in our SKIES area, we have training on families. We also have training on teaming and how to work on a team, because that is really a lot of what we do. Either they're working with families as partners or they're working with other team members. So we actually have training on that. And then a lot of training on evaluation and assessment. And sort of screening and how you find children and make referrals. Knowing what the services are and who the contacts are, what's the best way to make those contacts is really important for us. But I find that it's really all local. We can make the best plans at the national level and even at the state level, but if the local folks aren't talking to each other and don't know who's doing what when, a lot of times referrals don't happen like we'd like them to happen. So filtering down to that local level is really critical. I also want people to have skills and knowledge in resources, what's out there for families. It may be that Babies Can't Wait is not the best referral for whatever reason for that family. Maybe there's something else that's even more critical than trying to work on whatever the child's need is. And so having that big picture of resources is really important. And probably, I see my time is running out, follow-through is critical. And I don't mean follow-through from our end, I mean follow-through from parents. We can do all the screening in the world through universal newborn hearing screening or through autism screening or whatever other screenings, but when the parents tell me that they call and they're put on wait, or somebody says they'll call them back and they never call them back. These are families that don't have time for not to be able to talk to somebody when they try to call and follow through on a referral. So that's a real issue I think we need to work on. Broadening the definition of family. I actually work with siblings and grandparents a lot, and I think we've got to broaden it away from just parents. Other challenges, certainly working in rural areas. We have a lot of migrant families in Georgia, but also the real urban inner city is really an issue as well. One last thing before I run out of time is family members who are low literate. I've been doing some work with CDC on sort of what's going on with families who can't read all the literature we give them all the time. They go into doctor's office and there's, all these brochures, and on these focus groups we were working on, they said we can't even look, we don't even pick it up because it's not anything we're going to be able to look at. Interestingly enough, one of the hot resources for some of these families who are low literate is insurance hotlines. And they talked about there's somebody on that insurance hotline 24/7 who they can call and get information on child development. Sometimes it's a nurse, sometimes it's somebody else, but that was a resource that we had not even been aware of, and I heard it from lots of families. Certainly families in poverty, and I would add families who are homeless, and I know we've got somebody on our panel who specializes in that, but that's a real urgent need that we're dealing with as well. What does our profession need to know about the science of child development? Certainly the importance of language, talking to children in positive, interactive manners, the relationship of language and behavior, I would add epigenetics, the whole issue of social interaction, how those change. People have brought up toxic stress, all of those issues. Fidelity of implementation. Also, progress monitoring. Issues of data collection, my time is out. Let me just say, individual growth and development indicators, the IGDs coming out of University of Minnesota with Scott McConnell, might be a really interesting way to sort of measure this progress monitoring, that we've got to get data to be able to see where kids are going. And last would be embedding skills into everyday routines and knowing how to do that with families. Thank you.